Vitamin B12 is stored in the liver in large amounts, enough to last several years. This means deficiency develops slowly and often takes years to become noticeable. Patients with inflammatory bowel disease or chronic stomach problems are at high risk for deficiency. The terminal ileum is the main site of B12 absorption. Crohn's disease involving the ileum, surgical removal of the ileum or part of the stomach, bariatric surgery, chronic inflammation, structural complications, rapid intestinal transit, or bacterial overgrowth can all reduce absorption. Dietary restrictions, especially low intake of meat, eggs, or dairy, contribute further. Chronic diarrhea and malabsorption also increase risk. Certain medications can affect B12 levels. Proton pump inhibitors and H2 blockers reduce stomach acid, limiting B12 release from food. Metformin interferes with intestinal uptake, and cholestyramine or sulfasalazine can also impair absorption. Corticosteroids and biologics, however, do not directly cause B12 deficiency. Supplementation. For most patients without major surgery, oral or sublingual B12 is recommended. Oral and sublingual forms are equally effective, with no meaningful difference in absorption. Patients with ileal resection, significant ileum involvement, or post-bariatric surgery benefit more from injectable B12. Monitoring. The best test for long-term B12 status is urinary methylmalonic acid, more sensitive than serum B12 alone. Low B12 can cause anemia, abnormal red blood cell formation, reduced oxygen carrying capacity, and nerve-related problems such as numbness, tingling, and balance issues. High-risk patients should have B12 levels checked periodically, every few months, to ensure supplementation is effective and deficiency does not recur. High-risk patient summary, video ending. Patients at highest risk for vitamin B12 deficiency include those with Crohn's disease involving the ileum or ileal resection, patients who have undergone bariatric or stomach surgery, patients with chronic stomach or intestinal inflammation, chronic diarrhea, or malabsorption, vegetarians or people on highly restricted diets, including many IBD patients, patients with small bowel bacterial overgrowth, those using proton pump inhibitors, H2 blockers, sulfasalazine, or metformin,